everyone, Dr. David Perlmutter here. Welcome again to the Empowering Neurologist. You know, a recurring theme on the program has been to emphasize how the body parts don't live in isolation. You know, this is what we call the reductionist mentality that looks at the body as individual parts. The lungs are the bellows, the heart is a pump, the brain is your laptop, etc. We now recognize that the body clearly functions in an integrative way. It is integrated not only within the body, but, to a significant degree, our health and our physiology is influenced by relationships with other people as well. We know that we have this powerful relationship with these microbes that live upon our skin and within our intestines, and we have that relationship as well that is highly influential throughout the body in terms of very important processes. I will say that we've kind of neglected one area in terms of looking at the integration in the human body, and that is the mouth and specifically dental health. We've all seen the reports that show, for example, correlations between periodontal disease and risk for a cardiovascular disease, for example, risk for Alzheimer's disease if you have periodontal disease. And we finally have identified an individual who has really taken it upon himself to explore this in a very robust way, and has in fact written a new book that looks at the systemic issues related to dental health. His name is Dr. Stephen Lin. Let me tell you a little bit about Dr. Lin. We talk about the gut-brain connection and the mind-body connection. Well, Dr. Lin is focused on the mouth-body connection. Get used to it because it really is a powerful call for improving our dental health. He looks at ancestral nutrition, so in that regard, trying to emulate the effects of what our ancestors had eaten in terms of amplifying certain good gene pathways that code for health, that help reduce, for example, inflammation. He looks also at the notion of epigenetics, how diet affects gene expression, not only the gut microbiome like we've been looking at, but also the mouth microbiome as well. He has programs that are designed to really prevent chronic dental issues and as such go a long way towards reducing systemic disease. His book has just been released. Dr. Lin, Stephen Lin is Stephen is his first name, is a board registered dentist, a writer. He speaks globally. He has a very powerful online presence and has done a lot of work with the Sydney Morning Herald and the British Dental Journal. He's also written for one of the online resources that we like to popularize, and that is MindBodyGreen. And he also has online a really good TEDx talk that I would encourage you to take a look at. He has a background in biomedical medicine we're going to talk about today. But, most importantly, he's passionate about this notion of whole health. The notion that, in his case, dental health has a role to play in the health of the rest of the body. So his mission then focuses on reducing or even preventing dental disease instead of just treating dental disease. He began as a practicing dentist and realized that, today we live with crippling oral disease, whether it's cavities or bleeding gums, crooked teeth, things like wisdom teeth impaction. There's no doubt that the mouth of the modern human is not necessarily a healthy mouth. So we're going to explore these ideas and most importantly, get a look at what he calls the oral systemic link, what he describes in his new book. So let's jump right into our interview right now. Well, hello, Dr. Lin. Thank you for joining us on the show today.
It's a pleasure, David. Thank you for having me.
Delighted. In the intro, which you obviously haven't seen, I talked about how, one of the, I think, themes of the program has really been this interrelationship between what we used to figure were separate body systems. We've talked, quite a bit, obviously, about the gut-brain relationship, the gut-heart relationship, the mind-body relationship. But you bring an area that I think is somewhat neglected to the forefront, and that is what seems to be a powerful relationship between oral health and systemic health. And that's not the kind of thing generally one would hear when one goes to get your teeth cleaned, for example. So how did you get into this, and what have you learned?
Yeah, it's really interesting, isn't it? Because in society, we've really seen the dentist as something we go to go and get, a problem fixed. We've got a toothache, we've got a broken tooth. We really go, when times are bad, and we try and avoid it otherwise. And as a dentist, you kind of experience that. So you kind of live on the out of society, and people come to you when they've got a toothache or a problem. And there's we've got great tools to fix those kind of things now, but in my practice, I realized that I didn't really understand the disease processes that were causing these things. And, really, if we're honest, all of the problems in the mouth can be prevented. And so it began to bother me in my practice that I would see sick children, I would see sick adults. We're talking about people that are losing all their teeth. This is in, first world countries. And we have, tooth decay is the most common chronic disease in children today. And how are we letting this happen? And I dug into, what we would see as conventional dental literature, and there really wasn't an answer. We've known the sugar and tooth decay link for a long time now, and it hasn't helped us a lot. So what I started to think was that, why is this, and why have we created such a societal problem around dental health? It's a socioeconomic problem as well, because we separate dental and medical, and it really goes to the idea that we think the mouth is separate, but the mouth is connected to the rest of the body, and every time you swallow, we're swallowing thousands of bacteria into a gut. And so it really started to dawn on me that we've missed a big part of what we understand about human physiology, and there's a great diagnostic tool right here in our mouth for every human organ system. And the work you've done with the brain, David, is just has opened this up for myself, especially because there's actually such a connection to the brain. And that's one of the most exciting advances in the dental industry now, is that we're going to be able to spot signs of neurodegeneration, really prevent these problems just by getting to the mouth first and making sure that we understand these issues first.
I think that this might be a place where some would want, I think, a clear delineation between correlation and causation. In other words, do people who have a high risk for coronary artery disease and also have periodontal disease just generally taking not good care of themselves, so they have two separate issues? Or are you saying that there appears to be some causative event with respect to the mouth, the microbiome, or the mouth health in general, and these other inflammatory issues?
Yeah, that's a really great point, because the literature between and the correlation between gum disease and heart disease has been around for 30, 40 years now. And it's been hovering, between, whether we say, whether it's causation, whether it's correlation, and really the latest literature more showed that it was correlation, that there actually isn't all that much of a direct link between the gums and heart disease. Now, what the numbers say is that 85% of people that have heart attacks have gum disease. Now, so I think the problem there is that we've misunderstood. There's been a missing link in our understanding of the physiology between the mouth and the heart, and that the underlying causes of heart disease and the underlying causes of dental diseases, we've been looking at an infection-based model. So acute endocarditis really is where the dental heart link came about. People that have dental cleans, you go and you have a slight increased risk of coronary events. And so we've kind of seen it as, well, you're releasing bad bacteria from the mouth to the heart, that's causing bacteria. So it's this infection-based model. But what I think we're looking at now is that the coronary calcium score really is becoming a much more meaningful measurement for cardiovascular disease, and that's calcium balance in the body. And calcium balance is measured in the teeth. And so we can now start to see the underlying, really the root cause of what's happening, and get a better understanding of what's really happening between the mouth and the body.
I smile because there's got to be a pun there with root cause in dentistry, that's for sure. I want to just touch upon something, and then we'll get back to our discussion. But you brought up, I think, the idea of the slight increased risk of endocarditis from having your teeth cleaned. And here in the States, I think it's pretty much still standard practice to pre-medicate patients who have, for example, a prosthetic hip or other joint with antibiotics prior to having their teeth cleaned. Yet there is no evidence from the scientific literature that that has any role to play in terms of reducing risk of either sepsis involving the joint or other issues. What is your take on that, and your take on the idea of even prosthetic heart valves and pre-medicating individuals with antibiotics?
Yeah, that illustrates the point really well, because the literature does not support the prebiotic the pre use of antibiotics before a dental treatment in certain situations. And unfortunately, a lot of these times when patients are getting prescribed antibiotics, it's via routine rather than based on evidence. And so this really speaks to the fact that we're not understanding what the real link here is. It's this infection-based model. There is a lot more going on than a simple link between endocarditis and the oral microbiome, and we've misunderstood this link. So the thing is, dentists are very nervous about doing dental treatments without prescribing antibiotics to people with a prosthetic valval limb, because of endocarditis is a very scary.
But evidence-based medicine would suggest that by not giving individuals antibiotics, you are in line with current science.
Absolutely. That is absolutely right.
It's a tough argument.
Well, and we're taught that in dental school too. That's been around for quite a while now, and they kind of go, well, is it? And then they say, well, but you don't want to risk it, and it's like, but that's not what the evidence says. And so it's a vestige of years ago, when we really didn't really understand what was going on. So it's a really funny one, actually. And patients come into me all the time and they say, I need antibiotics before. And I said, no, you don't need antibiotics. And it's a real problem, because they think they're being neglected if they don't get the antibiotics. So we've got a real communication issue where the evidence has really been kind of we've not understood that link, and it's a problem.
Yeah. There are a lot of topics I want to jump on in our time together. And one of them is, it seems like most people, or half of people, have had their wisdom teeth removed. And it seems to me that if we've had wisdom teeth growing in our mouths for arguably, the past couple 100,000 years, or I'm certain, longer than that, then why is it suddenly that they're crowding out our other teeth and have to be removed? What's going on with that?
David, that is, I think, one of the biggest health questions on the planet at the moment, is that wisdom teeth impactions never happened through our anthropological history. And so Darwin actually was the first to kind of note and say, well, as soon as we kind of jump into the last couple of 100 years of the fossil records, the wisdom teeth kind of, they don't fit anymore. And, if you talk to an anthropologist about crooked teeth or even, impacted wisdom teeth, they'll laugh at you, because it doesn't happen. And if you look at any kind of the fossil record, the anthropological records, you'll see 32 straight human teeth. You'll see space behind the wisdom teeth. Now, I don't see that anymore. I see kids with tiny, skinny jaws where the wisdom tooth is pressed up against the second molar like this. And so there's barely enough space in the jaw for both. And I've even seen a lot of kids now with second molar impactions, and that's just absolutely scary. And we don't ask why this is happening. 10 million wisdom teeth are extracted in the US every year. And I have not seen, in my career, I've seen a handful of kids grow up to house 32 teeth.
That's me.
It's the generation, before, there's more people, but it doesn't happen anymore. Why aren't we asking this question? And a kid that needs braces, at 10 and 12, because they've got crooked teeth, it's the same issue when they're in later adolescence and a young adult, if they have wisdom teeth impactions. It's the jaw not growing. Malocclusion is a problem with the jaw growing, and it is caused by food.
We do a lot of literature research looking at dental calculus of our ancestors, because that's a rich source of genetic material that allows us to characterize the oral microbiome. And one of the things I've noticed is when we look at these specimens, these fossilized specimens of our ancestors, the teeth are beautiful. I mean, they're all there. They're aligned perfectly. That's another thing. It seems as if this misalignment of teeth is really almost pervasive nowadays.
It's everywhere. It's the biggest health epidemic on the planet.
Wow.
Our craniofacial system do not grow anymore. This is the base of what makes us human. Our neurological systems. These things are not developing anymore, and there's a direct link to as soon as we eat the industrialized diet, it happens. Any anthropologist, so Robert Corricini, did hundreds and hundreds of studies on the link between when the modern diet and hunter-gatherer diets and traditionals, even between urban and non-urban populations in Kentucky, for instance. As soon as you get into cities, you begin to get more malocclusion, so your teeth become more crooked. And so once we start eating that modern Western diet, then it starts to happen. And it's crazy that we've not seen this as a food-driven problem.
One of the areas of interest for me has been sleep issues as they relate to risk for Alzheimer's, both through the mechanism of chronic low oxygenation, which we call hypoxia, and also through the mechanism of non-restorative sleep due to interruption because of sleep apnea, restless legs, etc. And you, in your book, write a bit about the role of dental health in terms of sleep obstruction, or breathing obstruction rather. Tell us about that.
Yeah, this is a very exciting area of dentistry. This is where we're really getting into the area of prevention, because sleep is such a regenerative, important process that every person needs to go through at night. Your brain is going through, especially in childhood development stages, they're going through formative development periods. That the one thing that you need to do when you sleep is breathe, and the first sign that you're not breathing right is in the mouth. And so we will see the first signs. For instance, one of the most common signs and the easiest to spot is teeth grinding. And so sleep apnea is defined as a pause of 20, and apnea is defined as a pause of 20 seconds while you're sleeping. And if you count to 20 seconds, that's you pausing while you're sleeping, breathing. That is terrifying. But teeth grinding is actually a neurological response by the brain to open the airways. And so what it does is it's a detection of the airways from pressure sensors to tell the brain that there's a choking response. So it's actually a survival response, pushing us into sympathetic survival mode, like you're choking. And you can imagine what your brain is doing when it's trying to go into deeper REM levels of sleep. You don't go into deeper REM levels of sleep. So if you grind your teeth at night, if you sleep on your stomach, if you have this restless kind of movement where you don't get this deep rest, it's a sign you are not breathing right. And sleep apnea has a whole grade it's an entire spectrum of conditions. Sleep apnea is the most severe, but there's a whole population out there of people that with a condition called upper airway resistance syndrome, and that was identified in the 90s at Stanford. And so what they showed was that these people actually benefited from having a mandibular advance device, yet they were not diagnosed by polysomnograph for sleep apnea. And what it means is that you have increased pressure in your airway, and it's a simple equation like that. If your jaws don't grow, you don't have as much volume in your airway. So when you sleep and you relax, your airways have increased pressure and your brain is in survival mode. It's that simple.
So this really is a powerful connection then between global shifts in dietary patterns, the westernization of the global diet, and cognitive function moving forward, isn't it? And risk for Alzheimer's.
Absolutely. And look, the connection to Alzheimer's and sleep apnea is so strong, and it just makes such sense. And in the literature, we've just made such strong connections. But what I see in the dental practice, and this is the most common kind of syndrome we see that that slip under the radar. So the people that aren't being diagnosed with sleep apnea, and they're usually kind of a middle-aged to women that had orthodontic braces in their earlier in their life, small jaw. They're usually they're quite lightly built, so small neck, and what they describe is they have digestive issues. They grind their teeth at night. They don't sleep well. They're always tired. They're anxious and depressed, so they're often on medications. They have cold hands and feet. And so what this is a sign of is upper airway resistance syndrome. They're not breathing well at night. They're not sleeping well at night. They can't breathe through their nose, which is crucial to deliver nitric oxide. And the amount of people that don't breathe through their nose at night is also an epidemic, but it's from the jaws not developing properly. So people with those symptoms, you really need to think about how you're breathing. In the book, we talk about oxygen as the number one nutrient. So the first thing you should be doing, you're going to last minutes if you don't have oxygen. And don't challenge your brain you need to be able to deliver that to them. That's one thing you can do. 20,000 breaths a day, we roughly take. And so if you can deliver oxygen efficiently, you're going to feel, and your body is going to work so much better because of it.
Let me put you on the spot. This controversial topic. What do you feel about the fluoride addition to municipal water?
Fluoride's a very controversial topic. I think that it addresses a very small window of what dental disease really is. And so in our teeth, we actually have immune cells from the osteoimmune system. And so if you feed those cells the right thing, they're called odontoblasts, they send an immune response that will make you immune to tooth decay. And so these responses these cells are hungry for vitamins A, D, and K2. And so if you don't feed them that, which nearly no one eats a diet rich in fat-soluble vitamins anymore, then your tooth immune system is down. So that's a start. But then you've also got the oral microbiome. See, we've got bugs in our mouth that protect against tooth decay. And so just mentioning those studies that you talked about before, we know that we've lost diversity in dental plaque since hunter-gatherer days. That is an absolute fact. Same thing in the gut. You wrote about it so well in your book. It's the same thing in the mouth. Once we lose those protective bacteria and the ecological environment, then that's when you get pathogenic species overgrowth. So you've got an immune system, you've got the microbiome. If you harness them together through food, you're immune for decay. And so we're worrying about fluoride that changes a very small aspect of the tooth enamel. And
it is such a typical Western response. I mean, let's just take a step back. Everybody seems to recognize that sugar is related to cavities or caries. But what is the mechanism? Well, the mechanism is likely changes in the oral bacteria that enhances the growth of those bacteria that lead to degeneration of the teeth. The response here in Western countries is, well, let's look at some way of fixing that down the line. In other words, your diet is giving you diabetes. Well, we'll give you a pill to lower your blood sugar. The problem is diet related, that you're increasing your sugar, you're changing your oral microbiome. Old habits, again, second time for us, old habits die hard. So it's, there's a lot of controversy about the downsides of fluoride in terms of bone development, et cetera. So, you also mentioned in passing vitamin D. And, we see such deficiencies of vitamin D these days, and not surprisingly so when we realize that people are doing their best to keep their cholesterol levels as low as possible so they don't have the precursor to make vitamin D, A and B. Most people don't go outside naked very often. I'm not suggesting that's necessarily the best thing to do. But that said, I think we're just beginning to see relationships between vitamin D and oral health. How does that play in your practice?
Well, absolutely. This was the kind of life-changing aspect for me, is that once I realized that there were defense systems. So those odontoblasts inside the teeth, for instance, they are activated by vitamin D. They have vitamin D receptors. So vitamin A and vitamin D both activate those cells. They release immune cell proteins that then are activated by vitamin K2. So a patient's vitamin D levels, which every one of my patients are vitamin D deficient, and we're talking about 75% of the population. I would say even more, depending on where you take the measure. there's studies that just came out at the end of last year that showed that our levels potentially that we've been working on with vitamin D are potentially half because we made a mistake in, interpreting the literature. And so the power of using vitamin D, and here's the crazy thing about vitamin D, is that we know that chronic deficiency will deform bones, and we know what it does in terms of calcium balance in the body, yet we've ignored it in terms of what it does with our teeth and jaw. And there are links between, so the graded levels of deficiency in, for instance, there was a study in Canadian kids that showed kids below 50 nanomoles per liter have a higher risk of tooth decay compared to kids with 75 nanomoles per liter. And also there's been some studies, not a lot because there hasn't been a lot of, no one wants to study vitamin D as a preventative measure, but in terms of the intervention as well. So it is so obvious it's our skeletal system. I couldn't believe once I began, because I wasn't taught this in dental school. Nothing in the book was taught to me in dental school. And, when I began to read about vitamin D, I was like, this is so painfully obvious, and we need to fix this straight away.
It's true. That might be a good preface for a book, opening line. None of this was taught in medical school, or in your case, dental school. You talk about breathing exercises as, again, for that number one nutrient, which you call number one nutrient, oxygen. How important is that, and is that part of a dental practice?
Absolutely. So there's an exciting budding model of orthodontics now. It's preventative, and it's called myofunctional orthodontics. And so we can actually guide the jaw developmental growth of a child now. And the principles are about getting the function right in the face and the craniofacial system. So what we do is we intercept earlier in the growth cycle, and we make sure if a child is breathing through their nose with their tongue to the roof of the mouth and their lips closed, their jaws will grow naturally. And this is absolutely, wow. It's unbelievable. Like if you reprogram a child to breathe like that, they will grow straight teeth, by themselves even. And so that's just such how we have not used that in the past. And this has been around, the functional aspects of craniofacial growth has been around for a long time now. And it was ignored, unfortunately, once we began to get the extraction and braces model that popped up in the 50s and 60s. But it's coming back now. So myofunctional orthodontics, myofunctional therapy, breathing is a huge factor in the dental practice. When you breathe through your nose, as we said before, we deliver nitric oxide. Now, if you breathe through your mouth, you deliver cold, stale air that your lungs cannot extract enough oxygen from.
Mouth breathers. Yeah. So this notion of nutrition and dental health, and then be an extension to dental health and physical health, this isn't new. I mean, this has been in our literature for decades, if not longer than that, almost a century now. And that was inspirational for you, wasn't it?
It really was, yes. So probably the awakening moment was I took some time off from dental practice, and I actually backpacked through Europe, and I went to a traveler's hostel in Turkey, and there was a share traveler's shelf where I found a book called Nutrition and Physical Degeneration by a guy called Weston A. Price, and it had DDS on the spine. I was like, oh, DDS.
My kind of guy.
Yeah. I was like, all right, we'll look at this. And I opened it up, and it was nothing like I'd ever seen before. I went through 7 years of tertiary education, and it was completely different. And I discounted it the first time I saw it because I thought this is a bunch of baloney, surely. And so I put it in my bag and I forgot about it. But then eventually I went back to it, and Price wrote about, I think it is one of the most important human health books ever written. He documented a snapshot in the 30s when the modern diet was overtaking traditional diet. So he went around the world to 14 different cultures in nearly every different continent and looked at the intercept between the traditional diets and the modern diet. And so where societies had lived for hundreds of years, he looked at the anthropological record, he looked at their teeth, he looked at their diet, and he looked at how that affected, then he looked at the population, that ate the modern diet. And he showed through 15,000 photographs, through dental exams, through food analysis, that the dental arch, so these people had 32 teeth. In the 30s, this isn't very long ago, they had no decay, but barely any tooth decay at all. And they didn't have any of the chronic problems that he was seeing. Now, bear in mind, this was long before the chronic disease epidemic. So the type 2 diabetes wasn't a thing. Obesity wasn't a thing. He was seeing kids infected with tuberculosis, and he thought that food was connected. But so he showed this powerful mouth-body connection, and basically brought it down to 3 nutrients that the human diet has always been comprised of, and that cultures had all around the world built very deep food food practices around making sure that their children 6 months before conception, when you're pregnant with your child, you're about to build a skeletal system. So you're hungry for these fats, these nutrients, these fat-soluble vitamins that balance calcium. And this is exactly what he wrote about. And there was just one thing that he died before he figured it out, is that he wrote about vitamin A and vitamin D, but he also wrote down activator X, and he died before he identified it. And that was a 70-year mystery. It wasn't until 2007.
Again, for our viewers, that was a book written in 1939, a dentist calling attention to this massive dietary shift of processed flour, higher levels of sugar, and these processed vegetable oils. And, Dr. Weston Price pointed a finger at them and said, the nutrition these changes that we're seeing are having a huge effect. That's certainly what I think the paleo movement is all about, is that we've abandoned this relationship that our nutrition has had with our physiology and with our genome and with our microbiomes as well. And that's a relationship that goes back eons. So an amazing researcher, like you said, traveled the world, and a good book to read. In fact, I think I'll pick it up and read it again. It's terrific. Well, listen, let me say thank you for joining us today, and best of luck with your book. We're going to make sure that all of our viewers get information on that, because this is really eye-opening. You did a terrific job. Thank you.
Thanks so much, David. It was a pleasure. And thank you for all your work. It's really helped me on my journey as well.
Thank you. We'll talk soon. Bye for now.
Bye, David.
Opens up a lot of ideas for us, doesn't it? Again, as we look at the relationship of our bodies to various organ systems, what is the effect of a damaged liver on the brain? What is the effect of dysbiosis or loss of diversity, for example, of the gut bacteria on diabetes risk, on immune modulation? And as we've learned today, Dr. Lin has really laid the groundwork for a very important idea, and that is that our oral health is hugely important as it relates to the health of the rest of the body. And I think he very clearly gave us a good foothold in understanding these relationships that we've already seen with periodontal disease and risk for things like coronary artery disease, risk for Alzheimer's disease. Fundamentally, those are inflammatory disorders, and it looks as if, according to what Dr. Lin revealed to us today, that the health of the mouth has a heck of a lot to do with that process of inflammation. So I'd recommend taking a look at his new book. Very exciting and a really interesting interview. Thanks for joining us today. I'm Dr. David Perlmutter, and bye for now.